to run off on some other events, but we wanted to get you here tonight. We're glad that you're here to speak on this important issue for your community and others. And right now, I'll yield time to you for this.
Thank you, Congressman Collins. Mr. Speaker, I rise today in support of pharmacies across the country, especially the independent community pharmacies who operate in a tough business climate to serve rural areas and provide patients with convenient, affordable, and personal care. In my home state of Iowa, 72 of our 99 counties are considered medically underserved, and of these, 7 are served by only one pharmacy. Many of these areas are rural, and a large number of these citizens in these sparsely populated areas rely on their community pharmacy for access to life-saving drugs and treatments. Unfortunately, the implementation of federal policy to address the rising costs of drugs has left independent community pharmacists at a disadvantage. Often unable to cover the costs of maintaining and managing a storefront, community pharmacies are closing their doors at an alarming rate. This leaves many Americans without access to the timely, efficient, and personal patient services they provide. To that end, I'm most happy to co-sponsor H.R. 592, to ensure that pharmacists are recognized as providers under Medicare Part B, so that my constituents can have access to local health care services instead of traveling long distances to seek out care. Additionally, I'm also proud to work with Mr. Collins, as well as my colleagues across the aisle, such as Congressman Dave Loebsack from the 2nd District of Iowa, to lower costs of drugs and promote fair competition and choice, which will ultimately benefit patients. I will continue to work to pass legislation such as H.R. 244 to increase the transparency of drug payment rates under Medicare Part D and TRICARE while ensuring a fair, competitive market for generic drugs. Finally, I wish to highlight the work of Hardig Drug Stores, the second oldest family-owned independent drugstore company in America, which has locations throughout my district, including my hometown of Dubuque, Iowa. Hardig's pharmacies operate in 3 states, employing 437 people. I believe we should be enacting policies that allow these kinds of local pharmacies to thrive instead of shutting down. My hope is that through the continued hard work of their dedicated employees and the implementation of better policies at the federal level, these family businesses will continue to serve patients in and around my district for many years to come. Thank you, Mr. Speaker.